Hi, good morning. Thank you, Joe. As Joe mentioned, I'm Tom Hudako. I'm the Communication Director from the Utah Department of Health. I want to thank everybody for being here this morning. There has been a lot of really encouraging news on the vaccine front, even as recently as this morning, and certainly over the past week. We've been working at the Department of Health for months now on what our vaccine distribution plan is going to look like. And it's complicated, and there's a lot of moving elements to it. And so we wanted to provide an opportunity to brief all of you guys on what that planning looks like and how the vaccine will actually roll out to the public in phases as we start to receive the doses that will be coming to Utah. So addressing you for the majority of the morning is going to be Rich Lakin. Rich Lakin, L-A-K-I-N, is the Immunization Program Manager at the Utah Department of Health, and he is the brains behind the operation in terms of putting this plan together. The format for today, this is not intended to be a short and sweet press conference, but rather a really in-depth dive into what our planning looks like. So Rich will present for about 15 minutes, and then we'll allow for as many questions as we possibly can. He needs to be out of here at about 11:15. At 11:15, I do want to note for our Spanish-speaking media that the Lieutenant Governor will join us, and we will also have Edwin Espinel, who is from the Utah Department of Health, and I think most of you are familiar with, to be able to answer questions in Spanish for our partners at Spanish language media. So I will go ahead right now and turn the time over to Rich.
Hi, good morning. Again, my name is Rich Lakin. I'm the Immunization Director at the Utah Department of Health. So I'm going to take about 15 minutes and kind of address you, hopefully go through details about the plan. Again, a lot of the information that I'm going to present on is early. So, we really don't know when we're going to receive the vaccine yet. Okay, but we're in our planning stages, and I'll kind of go through this presentation so that you kind of understand at least generally where we stand and kind of where we're headed. Okay, so Utah basically, it's been divided into multiple jurisdictions. And what we have is we have our local health departments, okay, we have our health systems, we have our Indian health facilities, and we have our statewide coordination. And facilities, so basically facilities with the capacity that they can administer their own vaccine, okay, under these waves, under these phases and waves that we have. If they have the capacity to vaccinate their own staff, then the vaccine is going to be sent to them so that they can do that. And we have healthcare providers. Okay, we have right now we're onboarding many hospitals. So hospitals have that capacity where we can send the vaccine directly to them, and they can vaccinate their healthcare staff, okay, in how they see fit. Also, you can see a list. We have long-term care facilities that I will talk a little bit more. They will look at staff and residents and vaccinating them with partnerships. Okay, and then as we move forward in the process, we have healthcare providers that basically, when you think of pediatrics, family internal medicine, OB/GYN, internal medicine, all of these partners that would like to participate in COVID vaccination, they can have an opportunity, okay, and we will be working with them. And then also we have our local and regional pharmacies that will be partnership in receiving the vaccine and helping us vaccinate residents within the state of Utah. So facilities who do not have the capacity, we have to kind of refer them to our partners, okay, and our partners are local health departments, pharmacies that have the capacity to go out and vaccinate, and then community nursing services. So if facilities don't have the capacity, what that means is that these are the partners that are going to help assist them with the vaccination process. All right, so let's talk a little bit about phase one, wave one, potentially limited doses available. So when we first did our plan, we were kind of told that the vaccine would be coming possibly November 1st. So we knew that we would have really potentially limited doses at that point. Now that it's coming later, it looks like the limited doses may be a little bit higher than what we anticipated. So there could be more doses that will be coming. I don't have an exact number, but I feel like to be open about where I'm kind of estimating that how much vaccine we'll receive, it could be somewhere around 100,000 doses in the beginning. Okay, again, don't hold me to that because I don't know exactly how much vaccine we're going to receive. But that's kind of the indication that we have. So what we do is we met on a weekly basis with a prioritization group. And this prioritization group was about 20 occupations, from healthcare to policy to PIOs, local health departments. And this was a group of professionals that, hey, we met with them. We said, hey, where should the initial vaccine go? And we decided to prioritize that to 5 hospitals that saw the most burden at the time that we were putting this plan together. Okay, so that's LDS, that's University of Utah, that's Intermountain Healthcare on 53rd, Utah Valley Regional, and Dixie Regional. There are other hospitals that are seeing the burden also, we get that. But at the time, those were the 5 hospitals. So our plan is that as soon as that vaccine, that Pfizer vaccine, can be released, there's a potential that in November that vaccine could be delivered to those 5 hospitals because they have the ultra-cold capacity. It doesn't mean that they can start vaccinating because it's not been approved yet. So what that means is that it will go to these 5 hospitals, it will go into their ultra-cold facilities, and it'll stay there until the approval process is complete, and that means ACIP recommendations. Okay, that's really what we follow. And once all that is approved and we've got the clear to go, the vaccines at these hospitals, they can start vaccinating their staff. So during this time also, we are also onboarding as many hospitals as we can. We're working with 30 right now to onboard. And to let you know how difficult this is, CDC has a number of requirements. There's a provider enrollment agreement. There's an online, or not an online, but an agreement that's separate from the provider enrollment. There are trainings that are necessary. There are documents that need to be signed from all these facilities. So it's a long process. But we've got staff that are moving as quickly as we can. We hope to have those hospitals on board, an additional 30 hospitals on board, so that they can receive the vaccine as soon as possible. If those 5 hospitals receive it the second week of December, we're hoping that the additional 30 hospitals would be able to receive it just shortly after that, maybe 2 weeks after. If we're lucky and we get everything completed, hopefully we can add a few of them into that initial process earlier. So again, those healthcare providers, the hospitals that receive the vaccine, they'll be able to have an option. That option will be that they can determine who they would like to vaccinate first. Okay, it could be emergency departments, it could be ICU clinics, it could be urgent care, it could be housekeeping, however they'd like to vaccinate. We're leaving it to them. We're getting them the vaccine and letting them make the decision on how they would like to vaccinate their healthcare personnel at these hospitals. So let me talk a little bit more. Oh, well, I kind of covered this, but this is the limited doses. We put a timeline on there, December. Again, that's if all goes well. That means if all the data shows that it's positive, if everything looks well in the approval process, FDA approval, then that's kind of the time frame that we're putting here. And then again, those are the 5 hospitals that we've identified that for sure are already on board and ready to receive the vaccine. So let's talk a little bit about wave 2 and 3. Again, this is still under phase 1. Okay, and this is additional doses that will be available in January. And basically, as I had talked, that the remaining hospital facilities, we're getting them on board. And then we are looking at also long-term care, assisted living, skilled nursing staff, and other healthcare personnel that could be included in there. Now, the interesting part about this is that we are working on an agreement with a regional Walgreens here in the state of Utah to help us vaccinate long-term care staff because right now it would be up to the local health departments and community nursing services to take care of that population. So Walgreens, actually, we had just sent out to our local health department partners a long-term care facility list that shows that Walgreens will take up, or basically who signed up with Walgreens in these long-term care facilities, and Walgreens will take care of those facilities. The remaining facilities, will be up to local health departments and community nursing services to help fill the gap and get those long-term care facility staff vaccinated. So that's kind of the partnership that we have come January. Again, it is very difficult to plan when we don't know exactly how much vaccine we have. And I think that's a key perspective that we need to keep here, is that with limited doses, it obviously is going to limit how fast we can move the vaccine, how fast we can get occupations, professionals, the public, and everybody vaccinated. So that's kind of the in January of our partnership with Walgreens, local health departments, to start working on those long-term care facility staff. As we look at wave 4 and 5, which is still under phase 1, you can see kind of a time frame there, February, March. We have long-term care staff that previously were not vaccinated. They will start getting vaccinated. At this point, there's the federal partnership that comes into play approximately in February. And what that means is that Walgreens and CVS has a federal partnership, and they will start receiving vaccine approximately in that February and March timeframe to start vaccinating long-term care residents. Okay, and what they will do is they have a list. We have that list of all the long-term care facilities that had chose Walgreens and CVS, and they will work directly with them on getting them vaccinated. And they will receive the vaccine directly from the federal government, and it will not be a state allocation. During this time, as I had mentioned before, remember during January and also February, Walgreens is also helping us vaccinate staff. That is a state allocation of vaccine. So we're hitting long-term care facilities pretty heavy, pretty hard, because we've seen a lot of burden there in addition to the hospitals. And so it's important that we try to move as quickly as we can with that population. The coalition of the partners, so as we move out of this wave 4 and 5, we have a coalition partner from policies, from business, from healthcare, from public health, and the governor's office. And basically what that is now we are starting to put together a population of occupations that would be at a high risk level. Okay, and we have a risk level model that basically takes those that, for example, myself, I can work from home and can have very little exposure. Therefore, I'm a very low risk. So I would put myself as a number 1, meaning that I would receive the vaccine later. And then we have risk level 3, where a hospital or a teacher would fall in a risk level 3 because they cannot work from home and they have contact with others, and so therefore they would kind of fall in a risk level 3. And to kind of give you a perspective, risk level 5 would be a healthcare worker that has constant contact with those with COVID. So we are putting that together. Eventually we will release that information when we have that completed, and it'll be in the phases and these waves so that everybody kind of understands where they fall within this timeline. So let me talk a little bit about phase 2, and this is wave 1, 2, and 3. So now we're into phase 2. Approximate time frame is March through July. As I talked about this risk level, we've got also tribal entities, those 65 years of age and older. The workers with the risk level 3, as you can see there, we've kind of put a few examples: teachers, childcare, personal care, perhaps an airline. Well, again, we'll work with that group to ensure that we can prioritize exactly what those essential workers are. We have racial, ethnic groups, food prep, those with underlying medical conditions. And then at that point, as we continue to move through this phase, we'll continue to look at different risk level models, and then remaining workers in risk level 3 and 2, which would be prioritized based on the timeline that we'll be sharing once we kind of get it finalized. And then eventually we'll get to all of Utahns that will fall into that category.
Hey, anyone who's joining online, please mute your devices. We can hear your other conversations.
All right.
All right, hold on a second.
Okay.
I have to drop the hammer. If I can figure that out.
Good to go?
I think that's, I'll keep looking for any other offenders. Okay, you can continue, Rich, sorry.
Okay. So the time frame in that phase 2, again, 1, 2, and 3 is approximately March through July. All of Utahns, we kind of anticipate the July time frame when they can start receiving the vaccine. Again, it just depends on how much vaccine received. The important part of this to remember is that the Pfizer and Moderna vaccine come in 2 doses. So each individual that has received the first dose has to receive the second dose somewhere. Pfizer 21 days later, the Moderna vaccine 28 days later. And that really kind of puts a logistics planning into how the vaccine is distributed, because if we get 100,000 doses and we don't know exactly how much vaccine we're going to receive on the second dose, we have to be careful to ensure that those that have received the first dose can also receive the second dose 21 days later or 28 days later for Moderna. So it will be playing that card as we continue to look at the first and second doses during that time. So phase 3, this is, again, all of Utahns. Most likely there'll be a sufficient supply. At this point, the immunization program and local health departments will continue to partnership, and we'll partnership with our public and private partners to ensure that they have access to receive the COVID vaccine. At this point, the immunization program will monitor the vaccine uptake and coverage throughout the population. We will look at data to ensure that if there's pockets within the state of Utah that need to receive the vaccine, that we can get that vaccine there. And then we will continue to monitor the vaccine to minimize vaccine wastage. Very important. It doesn't make sense to get a vaccine out there and then waste it. It's very important that this vaccine is utilized the best we can, and we do that by looking at coverage. We look at monitoring the vaccine itself. We look at the capacity of all of our partners to vaccinate and ensure that they are utilizing the vaccine efficiently and effectively, and then we can send more vaccine to them as time goes by. So that all of this we have into play to view and review and make sure that the vaccine is used properly and ensure that all of Utahns can receive the vaccine. So here's a little bit of the vaccine timeline. I don't think this has changed much. However, when we put this together, this is approximately about 2 weeks ago, but I have not really heard anything from CDC that has changed this. So if Pfizer, the potential EUA filing is the 3rd week in November, and plus 2 weeks for VRBPAC recommendations, which is a board of physicians and other professionals that will review the data. And then after 24 hours, ACIP recommendation will then hold a meeting and they will approve the vaccine. And basically what that equals to is that either the 1st or 2nd week of December, if all goes right, okay, that's the key. If everything goes right, then the Pfizer vaccine could be in place. The Moderna vaccine, if they were to file the EUA in mid-December, plus the 2 weeks for VRBPAC, and then recommendation, and then 24 hours for ACIP recommendation, if all goes right, then the Moderna vaccine could be somewhere in place, I think, in January for them. So currently we're working, again, with the Pfizer vaccine, all the logistics that go into play with that, and then also the Moderna vaccine. We're ramping up to understand all of the logistics that go with the Moderna vaccine. Both of them they have a very high efficacy, which is great. This is really good news. I want to stress that the efficacy of a vaccine of 95% from both manufacturers is really exciting. Getting the vaccine out for Pfizer can be difficult. It's ultra low. So logistically, we have to be very careful and work with our partners to ensure that that vaccine is out and not wasted. Well, Moderna vaccine comes in a little bit smaller doses. It's easier to put in the freezer, and it has a longer shelf life and maybe a little bit easier for rural areas and frontier areas within the state of Utah. So keep that in mind as we move forward. And I believe that's the end of the presentation, and I'll end there. Okay.
You taking questions?
Oh, yeah.
Yeah, why don't we do this for our questions? Why don't we do one from the room, and then just why don't you enter your name in the chat online, and then we'll call on you from GoToMeeting.
Rich, so I wanted to ask at this point, and you keep revising the timeline because obviously when you presented to Health and Human Services, it was moved up a little bit, now it's moved later. General public distribution, just talking everybody able to get it, best case scenario is now July.
Best case scenario. Oh, yeah. So the question was regarding the timeline of when all of Utahns can receive the vaccine. I've actually said that July is probably the most likely scenario. However, again, based on how much vaccine, all of Utahns could receive it in June, May, June, but I still feel confident about that all of Utahns can probably start receiving the vaccine in July timeframe.
And is this an annual flu shot kind of thing, or is this, do you have any indications on, is this a one and done, does it have sterilizing immunity, or do I have to keep getting it every year?
So the question is about, is this a one and done vaccine? We actually don't have the data back regarding how this vaccine is going to go. Like, for example, once somebody receives the vaccine, are they going to have, is their immune system going to have a lifelong immunity like the MMR vaccine when you get your second dose? We don't have that data yet, so that's all I can really comment is really the efficacy of after receiving the second dose. The efficacy of the vaccine is 95%. So we'll have to see the data that comes out when the vaccine is approved.
Thanks, Rich. Next question is from Sean Maines from the Salt Lake Tribune.
Morning, Rich.
Morning.
Let me ask you, hi, Rich. Considering this plan goes past January 20th, has anyone from the state been in contact with anyone from Joe Biden's transition team? And corollary to that is the fact that there's been no coordination between the Trump administration and the Biden transition team. Is that making your work more difficult?
So I don't know if there's any transition communication between us and the federal government.
So if you're not a high-risk person or in a high-risk profession, just to make sure that I heard you correctly, chances of you getting the vaccine are probably not that great until the middle of summer. Is that right?
Correct. So let me give you an example. So I am not in high risk. Okay. So sorry. The question is, if you do not meet any of the high risk categories, over the age of 65, underlying medical conditions, etc. High risk occupations. For example, I can work from home, and I can have limited contact with the public in general, right? So I put myself in a July timeframe. So anybody that has limited exposure and does not have a high risk, then yes, that population would be most likely in the July timeframe.
What do you say to people who want this vaccine right now, think they need it, want to get it as if it were as plentiful perhaps as a flu shot? What do you tell them?
So the way to answer this is, I think,
What was the question?
sorry, the question again is, those that really want to receive the flu shot or the COVID vaccine and they're not able to get it because they don't meet any of the high risk
What do you
groups.
What do you say?
So what do I say to that? One thing that we need to remember is that even though the vaccine is coming out in possibly December, and we have a vaccination campaign through that time frame, it doesn't mean that all of a sudden the disease burden is going to be eliminated. This is a marathon, not a sprint. And even though we have vaccinated from December to July, we're still going to see probably a high rate of COVID cases. The things that are most important all the way even through vaccination is wearing masks, good hygiene, social distancing. All those things still go into play. And eventually, I believe that by the time we reach that July timeframe into this time next year, that we'll probably start to see a reduction in the disease burden of that. So those people that would really like to receive it, we still got to practice these same social distancing, wearing a mask, practice and washing our hands. All those still have to go into play.
I have 2 questions for you over here.
Wait, sorry, we're going to move to an online question, and
okay.
then you can be next. Sorry about that. Next one is Angela Levito from Bloomberg News.
Thank you for taking my question. When are you telling hospitals that they should expect to start receiving shipments of vaccines?
So the 5 hospitals that I had mentioned, they already know that they should be receiving vaccine probably around the second week of December. I also mentioned that there's a very good possibility that if all the cards fall in the right place, that the vaccine will be shipped out early or sometime this month into those ultra-cold hospitals that I had mentioned, and they'll hold the vaccine there until the approval process. That's if everything goes right, all the data looks well, and all the approval process. So the 5 hospitals, we've let them know that they could receive vaccine anytime. The additional 30 hospitals that we are working with, we are onboarding them as quickly as possible. We have not given them a timeline. Once we get all the CDC requirements back from them, that's when we'll start giving them a timeline and when they could receive the vaccine.
Thanks. We got a question here in the room.
Hey, quick question for you. So it seems like Utah's going to be using that Pfizer vaccine first. In that study, it said, there weren't the younger people tested, less than 18, and the older group, were included in that vaccination testing group too. So when July comes around, is there an age group that needs to be, specified for who can get this vaccine, or is that still just a waiting game to see, for kids and older people too?
Yeah, so the vaccine that's coming out, it's my understanding that it'll be 18 and older. And we do not know if it'll be approved later for kids. It's really on the clinical studies that they do. If they have not done clinical studies on the population that you'd mentioned, then the vaccine cannot be approved because it hasn't been studied. And so we know that the vaccine is for 18 and older at this point.
So are you guys working with any universities or schools around the area to maybe give them the vaccine?
We're not actually. They will fall in, those universities will fall into that risk category in how they will receive the vaccine.
Okay, thank you.
Yep.
All right, our next question is Bill Gephardt online.
Hi, Bill Gephardt with Gephardt Daily. I suspect when phase 1 and phase 2, as you describe it, begin to roll out, there will be a number of people who say, I don't fall into that specific risk category, but I really need the vaccine. Is there any appeal process that people can go through if they want to cut in line?
I don't know of an appeal process. We're just going to lay this out in what we feel is the most appropriate risk level and categories of individuals, professions that should receive the vaccine first. When pharmacies and private providers and clinics and all them receive the vaccine for the general public, we would assume that most people understand and follow those guidance, and that they fall within the categories that they should. It will be difficult for them to screen these places that are going to partnership in receiving the vaccine, but it really relies a lot on people's honesty to ensure that they fall within the groups to receive the vaccine. We do that because the data shows us who is our higher risk groups. And that's why we roll this out in phases to ensure that the higher risk populations receive the vaccine first. And those, for example, myself, who is at lower risk, there's no reason for me to receive the vaccine until it is at an appropriate time.
Okay, thank you, Rich. Thank you, Tom.
Hey, Rich, we got a question in the room. Oh, sorry. Hey, Mike had raised his hand to me, Tom.
Can you just hit your mic though?
Yeah, use the microphone on the table, please.
There you go.
Since this vaccine requires 2 doses, is it interchangeable between the 2 companies? If there's a shortage from one, can you go get your second dosage from the other company, or does it have to be all strictly one company the whole time?
Yeah, so they're not interchangeable. So if you get your first dose from Pfizer, you have to get your second dose from Pfizer. If you get your first dose from Moderna, you have to get your second dose from Moderna.
All right, next question is from Roger McDonough from KCPW.
Hey, thanks, Rich. You talked about those ultra cold facilities, hospitals that have those. The Pfizer vaccine you're currently, talking about using requires minus 94 degrees storage. Can you further explain what is required there, just for both those other 30 hospitals and for pharmacies, et cetera, to get up to speed on that ultra cold storage?
You bet. So we've worked with the hospitals so they understand they do have the ultra cold capacity so that they can store some of that ultra cold vaccine. So that's necessarily not a problem because they can store it in the early stages and they can vaccinate their staff. The difficulty and the logistics nightmare that comes with this, of the Pfizer vaccine, is that it comes in a box. Okay, it's shipped in a box. There will be the first doses of dry ice, which is pellet dry ice, comes with the vaccine, so that the facility that receives that box, they can take that pellet dry ice and recharge the box, okay, and so that they can store the vaccine longer in the box itself. There's also lots of requirements around how to store, adding dry ice, how many times you can open the box, and then once you're taking it out of the box, when you put it in the freezer, there's a short life at that point. When you thaw it, there's a short life in there. Also, when you put it in the fridge. So those that receive the Pfizer vaccine, they will actually receive information from us on how to, number one, there's minimum doses of 1,000, which makes it difficult for smaller clinics. So logistically, we work with kind of regions, hopefully that we can logistically use up that 1,000 doses among several facilities so that none of the vaccine is wasted. In the meantime, these boxes have a shelf life of about 15 days. So that means that if a facility receives the box, they have 15 days to vaccinate 1,000 people within that. So logistically, you can see how that's difficult. That's why it's easier to send the Pfizer vaccine probably to the larger systems that have 1,000 employees that can vaccinate, and then the Moderna could go to the rural areas and frontier areas because it's easier to send 100 doses than it is an ultra cold 1,000. I hope that answers your question.
It does. So the follow-up that I have is, what if one or the other doesn't get approved? I mean, is that like you're waiting for FDA approval, and conceivably something could create a hiccup there, and if not, then do those smaller rural hospitals suffer as a result?
Yeah, so we'll have to make those adjustments. Right now, we're anticipating that both of them are going to be approved. If either one of them don't approve, like for example the Moderna vaccine doesn't approve, then we do have planning in place where we can get that vaccine to those rural areas to ensure that we can get them vaccinated. But our hopes are that both of them will get approved.
All right, great. Next question is in the room. I just didn't see who's raising. Yeah, go ahead.
Yeah, this comes kind of from some of the stuff that's been talked about in Intermountain Healthcare. They've had a couple of Q&A sessions. They talked about the flu vaccine and the flu vaccine rate being very low in Utah. Is there a concern that will continue with this COVID-19? And I guess what happens if people do not get the vaccine? What's the effectiveness in the state?
So are you talking specifically about flu, or how it relates really to COVID too?
Well, the flu vaccine rate, the vaccination rate that people get vaccinated with the flu is low compared to other states. I guess what happens if that's the same case with the COVID-19 vaccine?
Well, that's a good question. So we do have ways of we've got antivirals. We have also flu vaccine that helps with the circulation of influenza, and kind of to reduce the spread. If we only have a 40% vaccination rate with influenza, then you can see that there's other processes such as like antivirals to help people recover from the flu. Again, you're talking about two different viruses. If we have a low vaccination rate regarding COVID, I don't know how that will look. But if we have a high vaccination rate, especially with a high efficacy of 95%, meaning that 95% of those that gets vaccinated have a really good immune response, that's pretty good. That's remarkable, right? That's a very big milestone, and I would anticipate that if we get somewhere around 60% with a high efficacy of 95%, that we could see a reduction even with a low vaccination rate. And I think it's important also to remember that through our surveys, we've identified at least that 70% of the population is very interested in the vaccine. They're either most likely to receive it or very likely to receive it. So that's about 70% of the population, and that's kind of what we're anticipating. Those are the numbers that we're kind of looking at.
All right, the next question online, we'll go with Max Baer from CBS.
Hi, thank you for hosting this. I'm wondering if you have a rough price tag for this distribution plan, at least through phase 2 or maybe through July. And if so, does the state expect and or hope that they receive more federal funds to pay for this?
I actually don't have a price tag of what this will cost. I know that there are several local health departments, and I'm sure other partners that have to, when they vaccinate, they have to pay those employees somehow. And so, especially local health departments, as they go out and they vaccinate, they've been underfunded, and so it's important that that they receive funding so that they can partner, they can help out vaccinations for all of Utahns. I do not anticipate, I do not know if we're going to receive additional care dollars. I have not heard anything regarding that.
All right, thanks. So yeah, one more in the room. We'll go with Ben and then, yeah.
Hi. Okay, so you said you're hoping for a 70% adoption rate on the COVID vaccine. What are we at with the flu right now? Because I know there's been a lot of push, if this is the year to get your flu shot, get it now. And what are we at as far as adoption? And I mean, just comparing the two.
Yeah, so a regular year for flu, we usually see somewhere in the 40% of the population receiving the vaccine. This year, I know it is higher. I don't have those current numbers yet because we don't have all that data, and of course, flu vaccination is continuing right now. I am anticipating that we will have a higher influenza vaccination rate this year, but that's just based on hearsay and what I've talked with our partners.
Hey, Rich, where does over here? Thanks, man.
And will you identify yourself?
Jordan Burroughs with ABC4 News. Do you know where Utah stands within the rest of the country in getting the vaccine? Are most states on par for this sort of timeline, or is Utah possibly leading the way and getting the vaccine first?
I would think that we're probably all in the same boat. We received the vaccine based on our population, which is about 1% of the total U.S. population. So that's, if there's 10 million doses, then we could receive 100,000 doses. I don't know how other states, where they fall in. There's several agreements that have to be into place that states have with CDC. We've met all those requirements, so we're ready. There could be states that either got those requirements done earlier or they still haven't done the requirements. I don't know where they fall on that.
A couple questions online. One from Grant Whitaker. Does your plan account for these vaccines requiring 2 doses for each person? And then Wendy Leonard will have a question after that.
Yeah, so our plan does look at the 2 doses. So logistically, when you review this, if we get 100,000 doses, doesn't mean that we can vaccinate 100,000 healthcare personnel right off the bat. We've got to know how many doses we're receiving in the second round. If we're only receiving a small amount in the second round, then we've got to leave enough for those to receive the second dose, but then we also have to start looking at those that can receive the first dose. Okay, and then as we move further down the timeline, we have to continue to look at those that had received the first dose, and then they have to get the second dose, and then we have a whole bunch of essential workers now that are starting to receive the vaccine for their first dose. So you can see how this all kind of goes in play, and based on, again, vaccine will drive the response. And so we will review the amount of vaccine that we have coming in to ensure that those that have got the first dose receive the second dose, and then so on and so on down that timeline.
So I'm going to be devil's advocate here, but are you worried about any of these partners or people within these organizations having access to these vaccines and selling them to, say, the highest bidders? And is there something in place to eliminate the potential for that black market sale of this highly sought after vaccine?
Actually, I haven't worried about that at all. I don't really have a response to it.
All right, any other questions in the room? Yeah, Brian Mulaney's got one.
Thank you again for all of the information today. A couple of questions, actually. Is there a projection whereby you think everybody who wants a vaccine will have one? And when can we, in your view, is there a projection also on when we can remove the masks and not worry as much about social distancing?
So in regarding to your first question, everybody that would like to receive the vaccine can receive the vaccine at some point. So, so yes.
Do you know when? When do you project that to be the case?
Well, when I say all of Utahns, I kind of put that in a time frame of possibly June, July time frame where they can receive the vaccine.
And in regards to the second question, when do you think there will be enough people vaccinated in the state where masks will not be necessary and social distancing will not be as necessary?
I can't actually project that. I don't know how many of the population at that point would be vaccinated. I don't know how the virus is going to be circulating. There's a lot of things that go into play. Like, for example, what we've been stressing all along is wearing masks, social distancing, washing your hands. That all plays a big role in the reduction. We know that vaccine is going to play a role in the reduction of the COVID vaccine, and they're going to intertangle here at some point in where we will at some point see where the infection rate of the COVID will eventually go down, but I don't know exactly when that time frame would be.
All right, looks like we've got Sonia Hudson from KUER.
Hi, I have a question about the phase where you're starting to roll it out to risk level 3 workers. How is that going to work? Like, if I'm a teacher or someone who works in food service, like, do I call up Walgreens and say, hey, I have this job, can I come in and get vaccinated? Is it going to happen through employers? Like, how are you going to, how would someone in one of those professions actually get the vaccine during that phase?
Yeah, so let's take teachers as an example. There'll be a vaccine where they will be able to either go to their local health department to receive the vaccine. There could be vaccine at that point in pharmacies, and if there is, then they could go to the local pharmacy. So those in that risk level 3, there'll be a number of options for them. We're hoping that kind of in that time frame, private providers could have the vaccine, pharmacies, local health departments will have it, community health centers. And so when we reach that, teachers need to receive the vaccine. That's a great opportunity where they can make an appointment with their pharmacy and go in and get vaccinated, or they could work with their local health department to get the vaccine.
And how are you going to ensure that people aren't just walking up and saying, you know, hey, I have this job, give me the vaccine, even when they don't? Like, you produce the W-2, is it just an honor system? Like, how is that going to work?
Yeah, it's on the honor code. We would hope that people would be honest and understanding that those that are higher risk should receive the vaccine first compared to those that are at a lower risk. And so it's really on an honor code.
Why did you decide to go that route, especially when we've seen just a general lack of compliance with COVID measures so far?
Well, I think in the screening process to ask our partners to screen for every little thing, such as I got to know, first of all, that you have diabetes or you have heart disease before you can receive the vaccine. If we have enough vaccine, if they come in, again, I'm optimistic that most people are honest and that they'll understand that, I can wait for the vaccine because there are people above me that are a higher risk, and I would like them to receive the vaccine, and so I'll wait. So that's kind of the process that we've encompassed.
Hey, Rich, 2 questions online, and forgive me if you already answered this one. How long do patients have to wait between doses? Is it shorter than the 15-day shelf life of the Pfizer version? So I guess that's a question about the Moderna vaccine. Do we know what the time is between doses?
Yeah, so the Pfizer vaccine is 21 days between doses, and the Moderna vaccine is 28 days between doses.
Thanks. And then another question from Wendy Leonard. How will people be contacted when they're up for vaccination, or will this be up to them to seek it out? And then that'll be our last question. Okay.
Yeah, so each of the vaccines come with a card, and the person that's giving them the vaccine, they will fill out this card. It'll have their name, where they received it, the vaccine that they received, and the date that they should return. Okay, so each individual will receive a card. There are some private entities out there that have a way of contacting their patients for a reminder to come back for their second dose. And then also we have our USIS registry, which is our immunization registry, and that registry can be queried by providers and others, where they can pull up those that have been vaccinated, and then they can use that list to notify their patients to come back for a second dose. So there's multiple avenues for them to receive a second reminder.
But what about letting you know if your time's up to go get the vaccine? Like, hey, how are you notifying people saying you're the healthcare worker, come in and get your COVID shot?
Are you talking about on the second dose?
On the initial dose, even just notifying people, or do you expect people to seek it out?
So the notification really is going to be in all of our communications in how we get this out to the public, just like we're doing right now. We're kind of showing our distribution plan. As we move through these different phases, then we're going to use the communications, not only via this way, but there's also digital media and other sources that people can refer to so that they know when to go receive the vaccine.
Rich, thank you. I hope everybody understands and can see the level of planning that has gone into this effort. I also hope everybody understands that this is a very fluid situation, and as we learn more about when the vaccine will come and how much will come, we will be making changes to our plan to reflect that. I do want to mention very quickly before we move on to the Lieutenant Governor that all of this information has now been posted on our website, which I believe is displayed behind me at coronavirus.utah.gov. There's a prominent link to find information about the vaccine. There was a question earlier about what happens if there's not good uptake on the vaccine. We really need people to have good information about this vaccine. The safety measures that have gone into producing the vaccine need to be front and center with the public. The public needs to be confident of the process that went into developing this vaccine, and that's why we're committed to providing information like this to you all. We feel that if people have good information, they will make good choices, and we really look to you to help us deliver that information. I do want to mention now that we have the Lieutenant Governor, Governor-elect Cox, joining us, I believe from home in Fairview. Governor-elect, you've got a room full of media here, and I know you had some opening remarks that you wanted to deliver, and then we were also going to have Edwin here as well to answer questions from our Spanish language media. So, Governor-elect Cox, we will turn it over to you. Thank you.
Well, thank you, Tom, and thank you to members of the media who are here with us. As Tom mentioned, this is an announcement. It's the best sign of this vaccine or this pandemic, knowing that these vaccines are going to be available, and knowing that they have performed at such a high level. I think have exceeded everyone's expectations, and getting good and accurate information to every is going to considering like allowing
Hey, Governor Cox, we've got one other person who's talking now. Let me mute everybody really quick. All right, Lieutenant Governor, let's try that again.
Okay, hopefully you can hear me now. We are just so excited at the optimism that we have now because of these advancements. We've exceeded all of our expectations, and I can't wait to be able to start delivering on this promise and getting back to normal soon. So we appreciate when we say that we want to get good information to everyone in the state of Utah. Of course, that means those that speak other languages as well. And so we've been asked by Spanish media to deliver a message, and I'm happy to do that today. So we'll go ahead and do that now. Tenemos que recordar que cuando la vacuna esté disponible, solo va a estar disponible para un grupo limitado de personas. Va a ser meses antes que el público en general tenga acceso a la vacuna. Será importante que el público continúe manteniendo la distancia física y usando mascarillas para ayudar a detener el virus. Seguiremos en esta lucha por mucho tiempo. La semana pasada ha sido posiblemente alertadora de toda la pandemia en la manera que podemos ver una luz al final del túnel. Tenemos dos fabricantes de vacunas que están reportando resultados muy prometedores en ensayos clínicos, pero queda trabajo por hacer. Ninguna vacuna va a ser aprobada a menos que la FDA la dicen que son seguras. Estas vacunas no cambiarían durante la noche. La distribución será difícil y lenta durante las primeras semanas o meses. Tenemos que trabajar para que la pública tenga confianza en el proceso y el producto. Esa confianza llevará a que más personas tengan la vacuna y a una mayor protección comunitaria. En algunas comunidades sabemos que tenemos más trabajo que hacer que en otras. Tenemos la intención de utilizar voces confiables de la comunidad hispana y latina para ayudar a construir esta confianza. Poblaciones raciali y étnicas que soportan una mayor tasa de infección serán priorizadas en nuestro plan de distribución de vacunas. Usted acaba de escuchar una descripción general de este plan y Edwin Espinal del Departamento de Salud está aquí para responder sus preguntas. Somos optimistas de que las dos vacunas serán efectivas. Confiamos en que estarán a salvo. Gracias por todo lo que están haciendo a proteger a nuestras familias y hacer seguro que Utah puede salir de esta pandemia muy pronto. Gracias. Thanks, everyone. And Edwin will go ahead and allow you to answer questions better than I can.
Gracias.